Oftentimes, people have been dying to be asked about this topic, or they've suffered so much they want to make meaning from their own experience. And a lot of times doctors don't even want to broach the subject. So that's usually the initial challenge. But once they ask someone, would you be willing to talk to this reporter about your depression or your child's depression even, they usually say sure. I just want them to know that I think that this is a normal situation that they're in. So that's sort of the first place, is kind of normalizing the fact that we all have mental health issues. And then I just, ask them to really tell me about their experience. I really try and put it in their hands. Tell me what it was like when you first started experiencing depression symptoms. What did it feel like? So really letting them define how they want to explain what their experience is, instead of a lot of pointed questions that suggest that I have a lot of preconceived notions about what they're experiencing. When I do audio interviews, people get a little nervous about the microphone right in front of their face at the beginning, so I spend at least a few minutes ice breaking and just chatting about something. I really let people tell me their whole entire story from beginning to end, maybe when they were diagnosed, when they first had symptoms, what it's been like. And sometimes that can take half an hour, sometimes even 45 minutes. But it gives the power to them to tell their own story. And then I go back afterwards and I'll ask the questions that I know that I really needed to get. But I find that, to go to your original question, is how do I make people feel comfortable? That's really helped, like letting them know that they get to tell their own narrative. That doesn't mean that you have to use their whole narrative in the final piece. And of course, you usually don't use it exactly the way they tell it. But letting them have control over their own story in the interview, I think is really helpful and important. I'm usually really strict about anonymity with most of my stories, but I generally make exceptions for mental health stories that I feel like there's a real sensitivity, and I can understand why people don't want to put their full names out there. But it's been less common than you'd think with people asking for anonymity. What I usually do is I'll ask them, is it okay if I use your full name? I'll just start that way. And I would say that 80% of the people say sure. Like by this time, they've already agreed to talk to a reporter. And they've also sort of had a conversation with themselves over, I'm putting this information out there for the good of the world, to make meaning of my experience. One of the documentaries that I did was on mental health, bipolar disorder in children and teenagers. And I did this maybe 10 years ago, maybe a little longer, before there was a lot of writing about it. And for some of the people listening to the documentary, they said this was the first time that they had really heard about these symptoms. Some people had said that they'd been experiencing just very troubling behavior with their children and hadn't thought that it might be a serious mental health issue. They thought maybe it was just obstinacy or behavioral problems. So my story put the idea in their head to go get professional help. Obviously, you never want your story to be their professional help, but to prompt them to go talk to a psychiatrist or therapist. So that was really gratifying to know that. And I've gotten a lot of messages from people, often with depression or bipolar disorder, or even post-traumatic stress. I've done a lot of reporting on that, saying just thank you for letting me know I'm not alone. Thank you for normalizing what I'm going through. I think, like most people, I've had issues with family members dealing with mental health struggles. I've never felt like there was enough information out there. So, like a lot of stories, they come from a personal interest. And I just started looking into things like trauma, the effects of trauma, mental illness like depression and schizophrenia. You mean, how do I stop from bursting into tears in the middle of an interview, that kind of thing? Sometimes I don't stop. Sometimes, I've done stories on people who have lost loved ones or really horrible trauma and horrible things that have happened to people. And I mean, I don't literally burst into tears, but sometimes it's a moment between me and the person I'm interviewing where it is a really sad, difficult thing. And it would be really weird for me not to have that reaction. It's really important that in any interview, it's not about me and my reaction, but I also don't try to hide if I have a reaction to it, because that would not be human, and that wouldn't be fair to the other person to feel like they're talking to a robot. I think so. I don't have problems finding people willing to talk about their mental health issues. I know that there's been a lot about sort of young people and anxiety, and especially in the last few years. I think that's a topic that someone might have thought 5 or 10 years ago, I don't want to admit that I have anxiety. And now it's just out there. And now if you don't have anxiety, what's wrong with you? I know, my own kids who are now in college, but they talk about being traumatized by this or traumatized by that. I mean, it's a little bit of a shorthand, and I usually remind them that there's a difference between being, quote, traumatized by a math test and having trauma from war or abuse or something like that. But it's a term that's out there that people understand has an effect, and it doesn't mean that there's something wrong with you. It means that something has happened to you and you are dealing with it. And I feel like that's a really important shift. There's really no evidence that talking about suicide puts that idea in anybody's head that wasn't already going to be there. So I trust them. I think it's probably much more important to talk about it. I feel like that's more likely to stop people from attempting suicide if they realize that there's help out there and that they can have that conversation. So if you're going to weigh those two things based on what the professionals say, that's how I look at it.